Welcome to Health Club with Julia. I'm your host, health coach, and registered dietitian, Julia Campagna. I'm on a mission to bridge the gap between looking your best and living your life to the fullest. After years of over-dieting, struggling with disordered eating, and destroying my social life, I finally found how to reach my dream physique without sacrificing the things I love. Now I'm sharing all my strategies and education with you. We'll be talking all things health, including hormones, metabolism, and lifestyle to help you cut out the confusion and start living. So get cozy and join the club. Hey guys, welcome back to another episode of the Health Club with Julia podcast. We have a very special guest today, Haylee Colannino. I'm sorry if I totally butchered your last name on that too, but she is the best when it comes to gut health, bloating, all the things. And so I think this is going to be one of my top listened to podcast episodes, I feel like, because everybody is dealing with this. I feel like everybody's like, I'm bloated all the time, or I want a flat stomach, or let me try greens powders, or just trying to get the bloat down. So many people go through that. And so I brought Haylee on to pick her brain and really get after it. She is a genius when it comes to this stuff. She's also a fellow RD, which I love. And people who don't know RD, that means registered dietitian. I love that because we can nerd out on stuff and just talk labs and all the nerdy stuff. It's really fun. And I love having somebody that I can do that with. So yeah, she's just amazing. And also I'll let her actually introduce herself first, and then I'll go into more about it. But Haylee, if you want to go and give yourself a little intro so we know who you are.
Okay, cool. Julia, thank you for having me. I'm hyped. This is going to be so much fun. But my name is Haylee. Like Julia mentioned, I am also a registered dietitian. I am a nutrition coach. I own a coaching business called Girls Fuel LLC, where I primarily work with women. The majority of my clients come to me for help with gut health, identifying the root cause of all of their different symptoms, whether it is bloating or constipation, diarrhea. I've kind of seen it all at this point when it comes to that. But my focus, while I've been coaching for a while, shifted to women's health probably 3-4 years ago. And ever since I became a dietitian a couple of years ago as well, that has really been, my passion is filling that disconnect. Because I feel like, especially as women, we're written off, we're told, your symptoms are normal, you're supposed to feel that way, you have to eat low calorie, all these things. And I think Julia is in that boat too. And that's why we vibe so much. We're here to debunk all of that for you and help you see what it actually means to take care of your body as a female. So this bloating topic is going to get a little spicy today.
Oh yeah, we got some good questions, and like you said, spicy. Spicy is good sometimes. Sometimes you just need some reality dose, and I think we're gonna do that a little bit in this episode. But I think you said it really well too. You're so passionate about this stuff, which definitely shows, and I feel like that is also great for these topics because you gotta have that dose of I hear you, I'm there for you, but also this is what it is, and your shit. And so also, for anybody that wants to go follow Haylee, I'm sure you will gain so much knowledge. There's a lot of information that she puts out there for things like this, gut health, hormones, bloating, all of that. So if you don't follow her, her Instagram is at Coach Haylee_RD. So spelling that out, COACHHAYLEE_RD. Make sure it's double E Haylee. And she also does have her own podcast. It's the Girls Fuel podcast. Go check that out as well. She's just a genius, and I want you guys to absorb all the information that she can give. So thank you for giving your intro and letting us get to know you a little bit more. And like we already talked about, I think you guys are going to love this episode. Absolutely love it. I think 95% of women say that they're bloated, or they're dying to get rid of the bloat, or they have the quote unquote pooch and they just don't know how to get rid of it. So let's dive in. I'm going to pick Haylee's brain for you guys. Get ready. It's going to be a good one. So a lot of people struggle with bloat. They don't know why. They don't know how to get rid of it. They're just kind of stuck with this feeling. Sometimes it's actual painful and uncomfortable. Sometimes it's just visible and they just don't want that. So let's go through some questions together and debunk some stuff. So first of all, can you tell us what it actually means to be bloated versus just say, eating a meal and needing to digest.
Definitely. And I think what you just said describes it pretty well, right? Normal bloating usually occurs after you eat a meal. And that's where you might feel like your stomach is protruding a little bit more than it should be. And I use the word should very loosely versus it being abnormal and painful. So for a lot of people, that's the difference. And I'm not saying your bloat has to be painful to be concerning, because I've definitely had bloat that was not just from, okay, I literally just ate, it was legitimate, like belly bloat because of a gut issue, which we'll get into. So that's one of the biggest differences, is it just a little bit more protruding than you're used to, or than when you wake up in the morning? Or is it like visible bloating after every single meal throughout the entire day? I'll have clients come to me a lot feeling like they're pregnant when they're very clearly not. And that's what we call like distension. So the difference between like bloating and distension is usually like how your belly feels. So with bloating, you'll usually still feel softness to the touch. Where with distension, it's almost like there's a balloon in there that it feels hard and very, very uncomfortable. So with bloating, it happens, especially to us ladies. We got a lot going on in there. So it can be normal. Your stomach isn't going to look the same in the morning as it is at night. And I think that's something that a lot of us can pick ourselves apart for. So my biggest recommendation to you, and this is some tough love right off the bat, stop looking at your body after you've eaten 4 or 5 meals. Do not step on the scale after you've eaten a whole day's worth of food. And I'll also say, being bloated after eating and having a little bit of that protrusion with some gas isn't all that uncommon. Like, girl, you might just need to fart. And that happens to the best of us. We're going to talk about ways that we can avoid that happening and avoid the discomfort. But sometimes, after a bigger meal, or maybe you're drinking too much water or XYZ with your meal that is causing bloating. So bloating happens. It is a normal part of the day. I honestly don't even consider it bloating when it's like, oh, my stomach's full of food now. Like that to me isn't bloating. Bloating is like when it's abnormal, that is often associated with other symptoms, which we're going to talk about. Are you having gas that smells like somebody crawled inside of you and died? Right? Are you having constipation, dizziness, nausea, even sometimes diarrhea we'll still see with bloating? And we'll talk about causes in a minute, but it's very important to know that you're going to see a little bit of a change in your body throughout the day. And the degree of that change is going to be different for every female, based on genetics, based on level of body fat, based on where you're at in your hormonal cycle, based on overall health. Because I will say, having just overall better internal health, gut health, having lower inflammation in your body is going to reduce how bloated, quote unquote, you get after meals as well.
Yeah, I think you explained that really well. And I love like the spiciness right off the bat, because I feel like there is a really big disconnect in what true bloating is, and just eating and going through a normal pattern of this, feeling a little bit more distended and needing the body to do its job with digestion and let things flow through. And there's a big difference, and also I think a big misconception with the two of those. And a lot of people, I think a lot of it also kind of stems from this mindset around it, and a lot of like the times you're mirror checking and you're like, what do I look like now throughout the entire day? And as your body changes, you're like, oh, here we go, I'm bloated. But that isn't always the case. And sometimes you just need to understand that your body has things going inside of it. It's not going to look the exact same as it does in the morning. And I think you did a really good job of explaining that and the differences between the two. And like you said, we're going to talk about, causes and how to avoid some of those things. But just simply understanding right off the bat that it is okay if you get a little distended after a meal, and you just need to wait it out and let your body digest. And it's good to give your body fuel and understand that changes are normal throughout the day. So I think that was a very well said answer. So let's go into more about bloating. What are some causes that you see with bloating?
Definitely. And I don't want anybody to feel dismissed by that either, because if you're feeling uncomfortable, like truly uncomfortable, like you feel like you can't wear the pants that you normally wear, you feel like, you can't eat because your stomach physically hurts, then definitely we're going to want to talk about that. I'm not meaning to dismiss you and be like, yo, bloating's normal, because to some degree it is. But if you're also having other symptoms, that's definitely where we need to slow down and be like, okay, what could be going on? Because there are a lot of causes of bloating. And I think if you were to Google, like, why am I bloated? The worst case scenario is going to come up. First, it's probably going to be like, you're pregnant, which, we've all been there. I don't know about you, but as a female, it's like, you Google anything that's wrong, you're either pregnant, dying, or, whatever it is. So obviously, Google isn't always the most reliable, and it's not always worst case scenario either. A lot of clients that come to me with bloating, before we even dive into, do you have a gut infection? Do you have SIBO? Do you have a horrible estrogen dominance problem? It's like, okay, let's look at the basics. Let's look at your meal hygiene. And what I mean by meal hygiene is, are you eating too fast? Are you eating in a rush? Are you stressed every time you go to eat? Because all of those things, the stress, the rushing, the not chewing your food enough, that is going to make it very, very hard for your body to actually be in a state where it can digest your food. They say rest and digest for a reason. If your body is in a sympathetic or more fight or flight state because you're rushing from thing to thing, you got to drop your kids off, whatever it is. And I totally understand that sometimes we just got to eat in those spaces, but there are things that we can do to improve our meal hygiene, to improve our digestive process before we eat. So that's where, if you feel like you're like, yeah, I eat in a rush. I probably eat too fast. I don't chew my food enough. Another one that I see a lot is drinking too much fluid or water during your meal. I want you to be hydrated. I really do. But I have found personally as well that if you are like downing water while you're eating, then you are going to be more likely to have bloat. It's just more in your gut. You're also more likely to have diarrhea, just because at a certain point your body's like, whoa, that was a lot. We got to get rid of this. So that's where I recommend, slowing down for one. I know maybe you only have 5 minutes to eat, and that's okay. I've definitely been there. Take 2 deep breaths. That literally takes 2 seconds. In through your nose, out through your mouth, nice and slow. Regulate your nervous system. Try to sit down instead of standing at your kitchen counter. Even if you eat in the car, put some relaxing music on. No rager hits while you're driving and eating at the same time. And just do really anything that you can before that meal to ground yourself. I have clients that will put more specific routines in place, whether it is that 2 deep breaths, maybe it's like tapping on their body. That's, a stress reduction technique to bring you back into your body before eating. For some clients, I recommend eating distracted. For others, I recommend eating without distractions. It's really going to depend. But the first step is to look at your meal hygiene. From there, look at your meal timing. A big reason that I see a lot of my clients bloat, and Julia's nodding her head, so I assume you see this too, is because they're skipping meals. You're going too long without eating. You're not eating breakfast, and your body is pissed, quite literally. Because your digestive process, really all processes in our body, like we can think about our circadian rhythm with sleep, they like consistency. We don't just say that for a reason, right? Our bodies like when we eat around the same times. Our bodies start to predict what we do. So on that morning that you're rushing around and you forget to eat breakfast, or you purposely don't eat breakfast, and this is not a podcast about intermittent fasting for females, but we can touch on it if you want to. If you're skipping meals, going way too long without eating, or I see this a lot with more of the, girls that are trying to change their physiques or look like an influencer, they're eating really low calorie throughout the day and essentially hoarding their calories at night. Or maybe you're just under eating during the day and you're binging at night. All of these wacky, erratic meal timing things are going to disrupt your digestion because it's unpredictable. Your body's trying to regulate its digestive juices and produce them when it thinks it has to. And if you're in a stress state, if you're not eating frequently, that process is going to change negatively. So those are some basics. Before I even jump to, is something actually going on with your insides? Let's take a step back. Let's look at your stress. Let's look at your routines. Let's look at things like sleep and all of that. So hopefully that was helpful.
Yeah, for sure. Touched on some very good points. And it's actually funny because just the other night, I was sitting down with my boyfriend having dinner, and he eats like a maniac. Like, he does not breathe during his meals. And I always say it, like, he's done a solid 10 to 15 minutes before I'm even like halfway done with my plate. And so the other day, I challenged him. I literally said to him, take 30 bites of your food before swallowing. And he couldn't do it.
hard.
He
It's really
couldn't do
hard.
it. It was like impossible for him. I was like counting out loud, like 1, 2, 3. And at like 15, he would swallow. He's like, I can't do it. And I was like, that's gonna help with your digestion. And it was just really funny because I feel like so many people do that and it just goes right over their head. Like they don't know that necessarily can cause bloat. But when people say that, I also don't think that they take it into enough consideration. And like that really does impact things. And it is hard. It's not easy to sit there and chew your food, but like rule of thumb, I always say chew your food until it's literally like mush in your mouth.
Yeah.
Like it should be mushy applesauce. But
Like
it's
baby food.
right, right. But it is hard. But the meal hygiene that you were talking about, I think, is so important. And again, people don't recognize how much that actually impacts them and their bloat. And so bringing awareness to that hopefully will help at least one person on this podcast say, okay, you know what, let me take a step back. Let me analyze and reflect on what I'm currently doing and how can I improve my meal hygiene and see if that is a problem. Meal timing is also a huge thing. And like you said, we won't talk about, too much intermittent fasting, but there is a reason why we do preach not to skip meals. And again, you said that beautifully. And I think that a lot of people hopefully listening to this can understand more about why after your explanation of that and see if that is also a problem for them and maybe start to make changes with that too. So thank you for that explanation. Covered that beautifully. And talking further into that, if somebody is feeling bloated from like morning to night and they wake up not feeling great even before a meal, if there's just this constant bloating, what could that indicate? What could that mean for them?
And when it is that constant where you're literally waking up and you feel that, and you're usually going to have other symptoms. So that's where obviously, working with a coach can be helpful to figure out what those are. But if that is you and you're like, I'm eating slow, I do all these things because I have to, you've been trying to navigate this for a while, I totally feel you. That's where we dig deeper and think about, okay, well, slowing down isn't going to hurt you. So please still do all of those things that I already talked about. Another one that I see a lot that can, vary in how severe of bloating it causes is just under eating, like chronically not eating enough calories. Even that combined with over exercising, just because it puts stress on the body and the digestive system. So that's another box to check in the beginning of, am I getting enough calories? But if you're sitting here like, Haylee, I literally cannot eat enough because I feel so disgusting and bloated and sick. And when I say disgusting, I'm not saying like, I don't like how my body feels and looks. I'm thinking like, I feel sick, right? So that's where we dive into the more like, I guess you could say medical causes of bloating. Some of the most common ones that I see that lead to that constant uncomfortable bloat and distension are going to be low stomach acid. So stomach acid or our gastric acid and juices basically are what come in. They get secreted from the stomach, produces stomach acid, contains HCl, digestive enzymes that help break down your food, especially protein. So if you are someone that gets tired after eating, especially after eating a higher protein or just higher calorie meal in general, your stomach acid levels might be low. If you often get a lot of burping, maybe even a little bit of reflux, along with your bloating, constipation, mucus in your stool, these could be signs that your stomach acid is low, and that is going to lead to poor protein digestion. That's probably the most common cause of bloating that I see, which it's not crazy hard to fix. We just need to identify it, and we'll talk about how to identify it in a few minutes here. Another one that I kind of already mentioned is low digestive enzyme production. These two go hand in hand, and they usually are a result of stress, poor dietary habits, like we already talked about, antibiotic use, different medications. But the combination of those two can cause symptoms like food intolerance symptoms and things that I've already mentioned, gas, etc. And we're kind of going down the spectrum from like least severe to most severe. So after we evaluate, stomach acid, digestive enzyme production, or even if they are low, we got to know why, right? If we do the things to support that, but you're still having issues, that's where we keep looking and we're like, okay, do you have an infection? Do you have a bacterial overgrowth like SIBO or a yeast overgrowth like Candida, a parasite, whatever it is? And I know you might be thinking, oh my God, but it's not that uncommon, unfortunately. It's not. And it's not a life or death thing. So if you've never heard of any of these things, you're going to be okay. Take a deep breath. Do not go Google those things. Shoot me a message. It's going to be okay. But when you have an infection in your gut, it basically changes your digestive process negatively and it can't function properly. And that's also where we start to see different symptoms like vitamin and mineral deficiencies in labs, but then associated symptoms. So hair thinning, nails just looking frail and crummy. Some people experience allergy-like symptoms, post-nasal drip, congestion, itchy skin was a big one for me when I was having those types of infections, constipation, diarrhea. Another one could be like a gluten intolerance or sensitivity. It's for some people harder to tell if they have one versus not. And celiac disease is common. Usually that's associated with bloat and diarrhea, or the swing between diarrhea and constipation. And then, the last box to check outside of, have we nailed the basics? Have we assessed your stomach acid enzyme function and determined why it's like that? Do you have an infection? Would be hormonal imbalances. I always focus on the gut first, just because it's the center of everything, quite literally. If your gut is not working properly, you're not going to be able to balance your hormones. But a common one that I see is estrogen dominance. So that would be high estrogen, especially related to progesterone. A lot of women will get bloating around the end of their follicular phase before ovulation if their estrogen is a little bit too high. And there's a lot that we can do to support that. So, if you are having that constant bloating and your doctor's like, no, you're fine, because my doctor told me that as well. Or if your doctor's telling you, you just have food sensitivities, you have to avoid all of these foods, that is not a long-term solution. It is not a way to live either. So it's definitely important to get to the actual root of what could be causing them. And hopefully that gave you a good starting point as well.
Yeah, I love that. I love that you kind of went down like checklist style, because people have like a good place to start that's a little bit like less invasive to, okay, I got to get a little bit more specific and kind of figure out what's going on. And it is unfortunate that a lot of times people do go to doctors, get things checked out, and a lot of the times it does come back normal. But just because something came back normal for doctors doesn't mean that nothing is wrong with you necessarily. And that's when you got to take it a step further. But I love that, again, you gave them like actionable takeaways with that, saying like, okay, did you nail down the basics? What about your stomach acid? And like different things to think about when it comes to bloating and what that could mean for them. And definitely going to vouch for it's okay if you have something going on and you won't die, you're going to be okay. Like, because I had candida as well, and I'm here to tell the story, and it was not that bad. Like, the protocols that you go through might not be super sexy and you might not love them for the time being, but it's usually you can fix what was going on without too many problems. So definitely vouch for that, but love the checklist. Go through that. If you think that you're bloating, kind of go through that checklist after listening to this and say, okay, again, reflect, analyze what's going on. Do you check all the boxes? Talk to somebody. If not, get a little bit deeper to find what that root cause is. So love that. And if you're somebody who's constantly bloated, and we kind of, like I just said, you gave them kind of like a checklist, but what are some things that you can do if you were constantly bloated?
Definitely. So the biggest thing, and it's kind of going down the checklist, but I'm going to give you a couple more specific things to try, because the biggest thing to realize is it's not going to happen overnight, especially if you're someone that's constipated, because those two things go hand in hand. And I'm just going to define constipation really quick, because I feel like everyone's like, I'm constipated. And it's like, okay, let's talk about what that really is. Constipation is defined as going more than, 2 to 3 days without a bowel movement. It's considered chronic if that happens for technically over like 2 of those cycles. So, 4 to 6 days. Constipation can also just be incomplete bowel movement. So maybe you're only going a little bit, and also how your stool looks. So if we're thinking Bristol stool chart, and I'm sure, Julia, you're familiar with that, if your poop looks like a rabbit could have shit it out, I hope I'm allowed to swear on this, a rabbit turd, or, a couple of rabbit turds clustered together, then that is probably constipation. We want our poop to be a Bristol 3 to 4, which is more of like a complete sausage that comes out all at once. And I'm sorry that this is getting graphic. We talk about poop here. It's what we have to do. But if you're also experiencing constipation, the biggest thing is just we need to get you to poop. We need to get that to happen. And it's not going to happen overnight. Your bloating is not going to happen overnight. I actually wrote a post today that I haven't posted yet because it's still a mess, but about one of my clients who's been working with me for about a month, and her main symptom was bloating and constipation. And it took about 4 weeks of her doing the things consistently, the things that I'm going to tell you right now, for her to actually be able to poop. Like her tracker, I don't remember what she wrote in it, but it was like, holy poop, Batman. And I laughed so hard. I was like, oh my God, I love this for you. But it's not going to happen overnight. So don't try one thing for 2 days and then be like, oh my God, I'm broken. You're not broken. There's something going on, but you're going to fix it. It's okay. So the first thing is just slow the heck down. Everything you do, take a chill pill. And obviously I know that that is easier said than done. This is where working with, a coach can be helpful, because I'm sure you do this too, Julia. We work with you on more than just, your diet and training. It's setting boundaries. It's looking at where your stressors are and how you respond to them. And then it's really just learning how to calm your nervous system before meals. Like I already mentioned, the deep breath thing is what most of my girls do. And they find that really helpful. I had somebody do this with her kids and I thought that was adorable, where their dinner was hot. It was on the table. It was in their bowls, but it was hot. So while it was cooling down, they took their breaths together, and it was like adorable. And that's something that I've challenged my boyfriend to do with me too, because he also literally eats like something's on fire. And he has to get out of the house. And I'm like, dude, you probably have SIBO because you eat like that. But anyway, so as much as you can, don't eat in a rush. And I tell my clients, as much as we want to eat around the same times every day, if you can wait an hour and not eat while you're doing 6 things, wait that hour. Do what you got to do. Try to relax your nervous system before the meal. Maybe you need to go outside and go for a quick walk. Whatever it is you need to do. Meal timing, we already kind of covered that. So I recommend eating within the first 60 to 90 minutes of waking, especially for us ladies. That is really helpful to help our thyroid get rocking and rolling for the day, to calm our stress hormone, cortisol, and also just get the digestive process started. Because technically motility, moving food through your digestion, happens better after you eat. We have something that is called our migrating motor complex that starts moving. It's like, the street cleaner of your GI tract, and it starts moving food through, and it causes peristalsis, those contractions of your GI tract, to aid in digestion. But it doesn't start cleaning the streets until 90 minutes after you eat. So that's where eating a meal in the morning and then eating from there every 3 to 5 hours is going to be very helpful, give or take. You don't have to be perfect with any of these things. I know I never am. So from there, if you're like, okay, I'm doing these things, I would suggest simplifying your diet. And that's what I do with clients. I'll remove some common food triggers to reduce inflammation, because it's very possible that your body is just a little inflamed right now. Doesn't mean anything's crazy wrong, but we just need to pull it back. So sometimes I'll pull out gluten and dairy, definitely pull out alcohol. If you're struggling with bloat and you're drinking, then that could be half your issue right there. So simplify the diet and cook your veggies. So I have a lot of clients come to me and they're like, I'm really bloated. And then I look through their food logs and they're eating like 3 cups of raw vegetables per day. And I'm like, okay, that's a lot. Digesting raw vegetables is very, very challenging. And I'm sure a lot of you have been like, oh yeah, I've seen that carrot in my poop from hours ago. I saw this corn in my poop. And that happens from time to time. But if that is a common thing for you, you often see undigested food in your stool. That is a sign that your body is having a hard time and you need to cook all of your veggies. Cook them in a little bit of oil, cook them in whatever you need to do so that they're nice and squishy, essentially. And just look at your calorie intake. If you're under eating, especially under eating carbohydrates, it is very possible that that stress is causing bloating. If you are constipated, I like to add in things like ginger tea, natural anti-inflammatory herbal recommendations that aren't like, buy this supplement. So once we've determined, what's going on, I'll add things like ginger tea. I have a couple supplements that I'll recommend, but I'm not necessarily going to give those here because they're not super blanket statement. Apple cider vinegar is something that I'll recommend that is pretty safe for most humans. Obviously check with your doctor, but what it'll do is it'll help boost that low stomach acid that we talked about earlier. It will help create more of an acidic environment in your GI tract. Just, 1 to 2 teaspoons, not teaspoons. Start with a tablespoon. Start with a tablespoon in a couple ounces of water before your morning or evening meal. Those are some things that can help. Now, If you're also having a lot of other symptoms, this is where we're going to want to dive into, well, why is this actually happening? A lot of times you can get rid of bloating by just, changing some variables in your lifestyle. But again, removing food groups, eliminating things, that's not sustainable. And if you have to do that outside of like you have celiac disease and you literally have to avoid gluten, we need to figure out why, so that way you can get back to eating like a normal human.
Yeah. And again, love that there's a lot of touch points in there that you gave people to actively be like, okay, let's write these down and let's check them off as we go. What am I doing that maybe isn't working yet? Let me try something else. And so there's a lot of actionable takeaways with all the things that you just mentioned, and definitely want to stay away from like buy the supplement and detox teas and stuff like that a lot of people do try because they're like, this is going to flush me out, but it also wreaks a lot of havoc on the inside. So well, that could be a whole nother topic, but definitely start with these tips that Haylee is giving instead of trying to do something that would cause more harm. So a lot of actionable takeaways from that, a lot of good things that they can analyze and see and go down the list and try different things. So let's say that you did try all these things and something still isn't quite right. How do we get deeper? What labs can we get done to see kind of what that root cause is and help us a little bit further?
Definitely. So when a client starts with me, I don't require blood work or anything like that. But if they have it from their doctor, there is a lot that we can learn about what might be going on. So blood work is not my go-to for figuring out what's going on with the gut. It will just give us clues to get there. I'll talk a little bit more about like the GI map stool test in a minute, because that's my go-to for like, all right, do you have some sort of infection? But oftentimes, looking at labs can tell us a lot. So a lot of the labs that your doctor will run if you do a yearly physical, the CMP, comprehensive metabolic panel, that is where I will look to see if my client has low stomach acid. There are a lot of markers in there, whether they're high or low, could tell us if stomach acid levels are insufficient, because of how low stomach acid, or stomach acid in general, impacts your ability to digest protein. So there are a lot of different things in there that we can look at. Your CMP also contains your liver enzymes. So if they are quite high and you don't have, a known issue or pre-existing condition that we know about, that could be a sign of inflammation, that something is going on in the gut. But a lot of it is just connecting the dots. It's very important. I don't know if you have a lot of coaches listening to this, but if you're a coach and you're listening to this, it's very important to see the whole picture of what your client has going on. If you have, their lifestyle information, you have their diet, you also have their labs, you use it all together. But blood work is going to be a big tool in that toolbox. So CMP, we went over. CBC, complete blood count. That's another thing that like every doctor runs just about every time you go to the doctor, and rightfully so. So looking at this, we'll be able to see if you have any vitamin and mineral deficiencies. If you are having a lot of vitamin and mineral deficiencies, despite having a pretty balanced diet, even despite taking a multivitamin or vitamin and mineral supplements, that could show us that something is up in your gut and you aren't able to absorb and or produce those vitamins and minerals effectively. So that's where we'll look at, your red blood cells, your hemoglobin, your hematocrit, all of that stuff to see, do we have a B vitamin deficiency? Do we have a possible iron deficiency? Is there anemia going on? Our CBC also shows us if we have any possible infections. We can look at our white blood cells. So obviously, WBC is the main white blood cell marker, but then we also look at things like neutrophils and lymphocytes and monocytes. And with those being high or low, that can show us if there's an infection. And just anecdotally from doing this for a while, those can be very, very telling for things like parasites or other infections that are super inflammatory. So a lot of times if my client comes to me with those labs and I see a lot of these discrepancies, I'm like, okay, we got to dig deeper, because chewing your food slowly is not going to necessarily fix this. There are more, looking at your cholesterol levels, your lipids are going to show inflammation. Maybe if your liver or gallbladder are struggling a little bit, different inflammatory markers like CRP could also tell if you have infection. Iron panel, again, we talked a little bit about that, but if your iron's low, that could, be low stomach acid. It could be related to an infection. There's a lot that we can look at with iron. If it's high, it could be stress. So blood work is a great place to start. However, if somebody comes to me and they're like, well, I don't have blood work, like, do you think we should start there with the gut issues? I say no. we can always circle back to blood work at another point. And I have a couple questionnaires I'll have clients start with, so that way I can get a guesstimate, a hypothesis, as I like to call it, of what I think it is. And I'm usually pretty good at telling. Have you seen the show Dr. House, or it's just called House?
I've seen like one episode way back when.
Oh my God, I love medical shows. I joke with my boyfriend. I'm like, I should have just went to med school. I'm kidding. I love being a dietitian. I'm not
Grey's
going to
Anatomy?
school. But basically, for those of you who have not seen House, he is a like he's a jerk, but he's a very like high level doctor who takes on only special cases. He calls himself like a diagnostician, and him and his team like try to put together all the dots of what could be wrong with their client that nobody else can figure out. And obviously, I'm not thinking I'm that good. There are plenty of people that can help you, plenty of people that can figure it out, but I just like love connecting the dots and being like, this is what is probably going on. Like, this is what we do to fix it. So if you don't have blood work, I wouldn't start there. I usually recommend starting with a GI map stool test. You do collect your poop. It's a little gross. If you've had kids, you probably won't think it's as gross, but it is really freaking cool what the report shows you. And that's what Julie and I both did when we were having gut issues personally. It will show you if you have, foodborne illness or some in the recent past, viruses, bacterial infections like H. pylori. It cannot definitively diagnose SIBO, but it can show dysbiosis, dysregulation of good and bad bacteria that can point us in the direction of a bacterial overgrowth. And oftentimes I'll lead with that over doing a SIBO breath test. Candida, which is yeast infection, parasites, worms, and it also shows a good snapshot of your intestinal health, because there's a lot that has to happen for you to have healthy digestion, right? Your liver plays a role, your gallbladder plays a role, all of these different, your immune function system plays a role. So the GI map shows all of that, and that gives practitioners like us a good idea of what's going on and what to do about it. And that's where for some clients it's dietary changes and an herbal protocol. For some people it's different probiotics. For some people it's, hey, go to your doctor and get this antibiotic. I definitely just see what it comes out with and lay the options out for my client from there.
Yeah, and I think that's a good thing to note when you've tried all these things and you're still not feeling right. It's like, okay, let's dive deeper, because a lot of the times there is a cause and we got to figure out what that cause is. And so the thing I will say with this is it is nice to work with a coach or some sort of professional with this, because it can get confusing reading labs or reading GI maps when you have no idea what's on there. And so if you do it by yourself, it could just lead you to like, okay, well, I have all this stuff. What do I do? So just side note on that, you might need to work with somebody a little bit more closely to figure out what your lab or GI map is actually saying for you. But it can be a really, really good option to figuring out what that deeper root cause is, so you can have a more personalized approach to what needs to happen for you. So what would be some daily habit tips? I know we kind of went over things on like how to kind of prevent that from happening, like being more present with your meals and better meal hygiene, but what are some daily habits that can help ease the bloat if you have it going on?
Definitely. So I think it's taking that initial step back and pausing and just getting curious with yourself. Like, okay, how did I sleep last night? Am I really stressed right now? Do I have a lot on my plate? Do I need to go work out today? Or do I really just need to go for a gentle walk outside? So it's getting more in tune with your body. And that's not going to happen overnight either. That's something that, can take a while, because a lot of times I think we feel bloated, we feel, quote unquote disgusting. So that's what I've had clients say. I don't think that's true at all, but you just don't feel comfortable and you think, okay, I just need to go run. I need to go to the gym. I need to work this bloat off. And that is usually the opposite of what's going to happen. So if that's where you are, and you feel like you don't necessarily have the best relationship with exercise, I encourage you to take an extra rest day and allow yourself to do things that help you relax and just help your body relax. So this isn't like a daily thing. This is like something to do if you're someone that's stressed about taking a rest day. Like instead of that, why don't you go on a gentle walk? Why don't you do something that doesn't feel like exercise, but it's still gentle movement? Like I've had clients like they play pickleball or it's going to be cold pretty much everywhere right now, but they go walk the beach or they just call a friend, whatever it is, taking an Epsom salt bath, just anything that you can do to allow yourself to slow down, because beating up your body is going to make everything so much worse. Simplifying your diet is going to be really helpful on those days that you're feeling super yucky, almost like bro dieting it, lots of rice, because most people don't have a hard time digesting like white jasmine, that kind of rice. Pulling it back that way, whole foods, cooking your veggies down, slowing down. Those are all going to be big things. And then if you are constipated, there are different tools that you can use in your toolbox to help get things moving. Adding magnesium is something that almost every female, especially, but everybody should do. A supplement there can help with motility. It can help with bloat, muscle contractions. It can help relax the GI tract, because a lot of times, especially if you're having painful bloating, there's contractions going on and gas and all of that. There are different yoga poses that you can do, which obviously I can't show you right now, but that are helpful, getting in like a happy baby and all of that. Tea is going to be also really helpful, but I think the biggest thing is just like giving yourself grace and not expecting it to be magically better in 1 hour because you did one thing differently or anything else. Also just change into comfortable clothes, because having tight clothes on is the worst thing that you can do to yourself physically and mentally when you're bloated. It actually restricts digestion if they're that tight. So that's where, a whole separate conversation could be, do you need to just buy a size up in your pants? Like that is something that we might need to talk about as well. So I think there's a lot of different things that you can do, but the biggest thing is like anything that you can do to distract yourself a little bit once you know you're doing all that you can. Because frantically trying to do things, and I have definitely been there, it made everything worse, running around, trying this tea, buying this kombucha, buying this greens powder, spending hundreds of dollars on Amazon, and not having anything work for more than a week is not sustainable for your mental or your financial health. So it definitely slow down. That's going to be the biggest thing. And just get into routines with your meals, get into routines with your food choices, get into, routines with how you treat yourself, and hopefully that is at least a start to ease things and while you're working towards the root cause.
Yeah, I love that you mentioned the slowdown, because you are so right. A lot of people will be like, okay, I'm bloated. I don't feel good. Let me go do more and more and more and more. And they just try to like, quote unquote, burn it off or just try to do the most, when realistically, if they did the opposite of that, a lot of the times that's going to help them feel better. And I love that you touched on that. Hopefully that is enlightening to some people. And that does come with, healing your relationship with exercise and with yourself. And like you said, it doesn't happen overnight, but it's really something to bring awareness to, and just making your body feel really safe, I think is a really good thing to note there as well. But I also, so this next question is a little bit more of like your personal opinion, but also can give a little bit of good insight on these things too. So in regards to bloating, what are your thoughts on things like taking probiotics or greens powders?
I think that they're vastly overused and blindly used. Greens powders, I'm not going to lie, I don't ever recommend them to clients. There are very, very few that I'll ever even touch myself. Just there's been some research over the last couple of years. You've probably seen that they're, supplements aren't regulated like at all. None of them are. I mean, I'm not trying to scare you, but there have been studies and stuff that have shown, heavy metals and different greens powders. And there are also just so many freaking things in there. You don't know what's going to help. You don't know what's going to irritate you. A lot of them have wheatgrass, which a lot of people cannot digest. There's just a lot going on in there. And if it's that, or, you feel like you're not getting your veggies in, take a multivitamin. Take a multivitamin, eat as many veggies as you can, switch up your food variety. But greens powders are very, very, I can't even think of a situation where I would really recommend one. Can you?
I mean, no. And I will totally be honest, own up to it. I used to be that person that was like,
Okay.
fitness influencer. I work for a company, so like buy these greens powders and they're absolute magic. And that was like me for honestly probably like a year, maybe even more than a year that I was doing that. Like, please buy these. They're amazing. Really good marketing. I was like all gung ho about it. But the more that I've learned and understand, the more and more I outright say, just like you said, it's way overused and I would not recommend them to anybody.
For sure. And probiotics are great. I love probiotics, but I don't think everybody needs one. And I think, again, they're overused. I actually did a post on this recently, just breaking down, the different strains of probiotics, because I think a lot of people see probiotic and they just think they're all pretty much the same. And there are like trillions probably of different species and bacteria types, and they all interact differently in your gut. So blindly supplementing with some of them can cause more harm than good. And I'm not trying to scare you either, but if you do have a bacterial overgrowth or SIBO, there are some that are going to make that worse. There are certain issues where we pull out fermented foods, no kombucha, no specific strains of probiotics, because they're going to make things worse. I think they're just overused because the first thing that you Google when the first thing you find when you Google gut issues, digestion, bloating, besides pregnancy and death, is going to be buy a probiotic. And they do have their uses. I use them with almost all of my clients that have gut issues, but not forever, and very, very, very strategically. Specific products, specific strains for specific uses. And everybody's going to respond really differently. So this is one of those things where if you want to be able to, take the right kind for you, reaching out for help can be really helpful, instead of just blindly buying them and taking them.
Again, I love that you touched on that because a lot of people don't even know that there's a lot of different like strains of probiotics, and for certain issues that you have, you can get certain strains. So just taking a generic one, like you said, might make things worse. And I think people are Google is like good and bad.
Yeah.
In so many different ways. And like this is definitely one of those. Probiotics are highly like first thing, buy probiotics always when you Google like what do I do for bloat. But yeah, definitely can make things worse and can be overused. They're not inherently bad, I wouldn't say, but should be used more specifically for what you have going on. So just again, bringing awareness to that and being wary with what you're buying and how you're using it. So, but I think that we covered so many great things in this episode. And like I said, I think that this is going to be one that a lot of people will really enjoy listening to because it's very relevant for a lot of, especially females. And so, yeah, I think that this was amazing. Is there anything that you feel like we missed or you want to add anything else?
I think we covered it. That was really fun. If anyone has questions, I'm an open book. So there's no TMI when you're a dietitian. So whatever you got to say about your poop or whatever it is, we're here for it. I would just say, give yourself some time and space to figure it out, especially, if you've been dealing with this for a while. Definitely look at the approach you've taken thus far and consider the other ones that are out there.
Yeah, for sure. And definitely nothing is TMI. I feel like clients are always like, oh, I don't know if this is TMI. I'm like, no, give me everything. The more info, the better, honestly. I feel like that's like how we're taught to. Like, that's what we do. We're here for the poop and all the TMI stuff. So we love that. But thank you so much, Haylee, for coming on and allowing me to pick your brain. You gave us so much good information and active things that we can start doing now to help us with these situations. So again, guys, if you do not follow her, go follow her on her Instagram. It is at Coach Haylee_RD. I will put that in the show notes for you guys to just click the link there and go follow her. But you will learn so much from her. Like I said in the beginning of this, she's a genius. And I hope you can tell by now and this episode that she really knows her shit. So that is it for this episode. Thank you so much for joining us, Haylee.
Thank you.
Thank you so much for listening to another episode of the Health Club with Julia podcast. If you love the episode, share the podcast and tag me, and subscribe so you don't miss any further episodes. If you have any questions, feel free to send me a DM. Thanks for being a part of the club. See you next time.